Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, what is the mammographic differences? The mammographic differences in benign and malignant tumors. So, if it is a benign tumor, what are the differences and malignant tumor? Now, if it is a benign tumor, always in benign tumor the margin is smooth. There is smooth margin is seen in benign tumor, whereas in malignant tumor there is ill-defined margin is seen. Ill-defined, that is, it can be irregular or stellate margin or spiculated margin is seen in malignant conditions. In malignant conditions, there is ill-defined stellate shaped or spiculated margin, and this is also called as comet tail appearance is seen in malignant benign in malignant tumor, whereas in benign tumor it is of low density, whereas malignant tumor is of high density. In benign tumor it is homogeneous lesion, whereas malignant tumor is heterogeneous lesion. Benign tumor shows thin halo. So in benign tumor, a thin halo is seen, whereas in malignant tumor, wide halo is seen. In benign tumors, we see microcalcifications. Microcalcifications have diameter more than 0.5 millimeters, whereas in malignant tumors, there is microcalcifications of diameter less than 0.5 millimeters. This is macrocalcifications. In benign, you see macrocalcifications, whereas in malignant, we see microcalcifications. So in benign tumor, breast parenchyma in benign tumor is normal, whereas in malignant tumor, the breast parenchyma shows architectural distortion is seen in the malignant tumor. Then in benign tumor, nipple and areola is normal in the benign tumor, whereas in the malignant tumor, nipple and areola is retracted in the malignant tumor. Then in benign tumor, skin is normal in the benign tumor, whereas in malignant tumor, skin is thickened in the malignant tumor. In benign tumor, you see Cooper's ligaments. Cooper's ligaments are normal in the benign tumor, whereas in the malignant tumor, Cooper's ligaments are thickened and they show increased number is seen in the malignant tumor. In benign tumor, there is subcutaneous retromammary space is seen in the space is normal in the benign tumor, whereas in malignant tumor it is obliterated in the malignant tumor. Subcutaneous retromammary space is normal in benign tumor, but it is obliterated in the malignant tumor.
thank you and thank you for watching.